Okay, well, we're going to go ahead and get started. I'm Molly Edwards. I'd like to welcome everyone and all the panelists to the Flinn-Brown CivEx Arizona Youth Survey and Fentanyl Awareness Panel discussion, where we will discuss Arizona's serious fentanyl crisis. Again, I'm Molly Edwards. I'm the Flinn-Brown Leadership Graduate from Class 2, so I've been with the program a long time. I'm also the Public Information Officer and Legislative Liaison for the Arizona Criminal Justice Commission. Our panelists today are Arizona Criminal Justice Commission's Executive Director, Andy LeFevre, Demand Reduction Coordinator for Arizona high intensity drug trafficking areas, Shelly Mowrey, and Congressman David Schweikert from Arizona's 1st Congressional District. The issue of fentanyl is a very serious issue and one that we are realizing is relatively unknown for a number of people and parents. This became most apparent when Arizona Criminal Justice Commission conducted their Arizona Youth Survey. And with that being said, I'd really like to jump ahead to Congressman Schweikert because he has a floor hearing today, and I'd like to get things moving with him. So, you know, Congressman, you have been at the forefront of this issue, fighting for us on the national level. Can you provide an overview of what's happening at the federal level for our viewers today?
All right. Look, the first is both good news for all the wrong reasons. In Congress, there's suddenly an awakening on the scale of the fentanyl issue. You know, for a while, it seemed to be, well, that's something you border states have. You know, when I think 3 days ago, having a conversation with a member from Ohio, and they were talking about, look, they have a meth problem, they have this, and now he's all saying, all of a sudden, it's fentanyl. And in the upper Midwest. The positive of that is when you start to get Congress paying some attention, saying, oh God, this synthetic opioid is everywhere. It's really inexpensive. It's incredibly potent. And now you have things that terrify us as a border state when, and forgive me if I mispronounce it, is the proper name Nazepines? The animal tranquilizers now actually also popping up, which are even 10 times more potent. And we're tracking some DEA reports saying that that's popping up now. But let's actually have just a really uncomfortable moment here, and forgive me if I'm not sounding as warm and fuzzy as I should as a politician. But take a look at our homeless issue. Go talk to someone from the Phoenix Police Department of the number of that community that are dying. And the fentanyl overdose. The fact of the matter is the price. When 2 years ago, it was $100 some to get high for the day. Today it's $12. That gives you a sense of some of us in the federal policy, we have failed. Whether it be border issues, whether it be traffic enforcement issues, whether the fact that now we're actually discovering precursor chemicals, the raw chemicals even coming across the border. We're just fighting for basic awareness, let alone the chaos this is bringing. And to hyper-personalize it, you know, my wife and I, we're adopting a little boy right now. And when we went to pick him up, he had been there for 4 or 5 days, and he shook for the next couple of weeks of his life because of being exposed to fentanyl and meth. And we don't know what's his life going to be like 6 years, 10 years from now. Will it affect his learning? When the head nurse is telling you that 30% of their babies are testing positive for fentanyl exposure. What does that mean, not only immediately, but what does that mean for education a decade from now? You know, we know a lot about meth, we know a lot about alcohol, we don't know a lot about synthetic opioids.
You know, Congressman, and I think you're really hitting on the issue of when we're talking about the synthetic, and this is new to Mexico, because normally they've done cocaine and marijuana and so forth, and now they're compounding, you know, fentanyl, which is part of the big problem. They're just they don't know what they're doing. And so when we talk about, I think it's the number of pills that are coming. Arizona is the highest trafficked area for pills coming across the border. You know, I want to switch to something that we know is an issue, and that's, you know, with you know, social media platforms like WhatsApp and Snapchat and some of these other, you know, platforms that they use to, you know, advertise to our kids and to adults. Is there anything Congress can do to maybe regulate any of these social media platforms at all?
There both is, and you have to have a brutally honest discussion. How effective would it be? The fact of the matter, we've held some hearings and discussions on, could you actually go at WhatsApp? Could you go at, and this is even in human smuggling as well as the narcotics movement and those. And we've also had testimony saying, oh, fine. You just go to an encrypted app that's based in another country, and that becomes, whether we like it or not, we're going to chase the technology, try to find some way so it's not the hyper easy conduit to move the market. But you're not gonna like my answer. Some of the experts we had came in here and said they could produce another app that would have the same levels of encryption, that would be a substitute, and might even be harder for law enforcement to track. This is one of those really difficult, there are some quirky solutions, not as much as trying to stop these platforms or find a way to properly encourage these platforms not to allow these dodgy things, but also to get them to put up the warnings. Do understand, if you think you're buying this, it may not be that. It may be just something stamped and being fentanyl, or do understand how many people die a day doing this. So they're not the answers. We'd love to be able to say, hey, we can shut off the information like this, but in today's technology, there's almost so many ways around those technology shutoffs.
And with that, because I know you're short on time, I just want to, you know, we've got the whole aspect of being proactive and then reactive. And the proactive efforts, I know we see in the headlines constantly where law enforcement is doing all of these seizures, and that feels like it's like drinking from a fire hose, or doing everything they can to try and fight what's happening at the border. And I know the border issue isn't one of those really, it's not a simple solution, but that's one of those things they've talked about. And I don't know what the answer is. I mean, I remember working on drug-related issues back when I worked for the AG's office, where we were going to go after Western Union, and we were going to start, you know, putting fines on Western Union because they cared about the money and how the money was going to get across the border. Yeah. I think it's really going to require some creative thought, but what's your thought on that? Your final thoughts?
The problem is now you can just move the money on this.
On the phone.
And whether it be crypto or the encrypted information that can travel with that, the technology is moving faster than we can write legislation. And there's other very uncomfortable, and for, you know, those of you who have the expertise, it's part of my former legislative district. I'm going to give an example. We would have constituents coming to us saying, I live at 33rd Avenue and Cactus. I believe the hotel over here is a distribution center of fentanyl. I can see it in the parking lot every day when I'm on my way to work. How do you get the citizenry that sees the crisis in their own neighborhoods? How is their information used? How do you get law enforcement to actually be able to use it? And then when you have someone like City of Phoenix that actually has had Justice Department and others sort of rein in some of their activities, in many ways, we're almost fighting against ourselves. I believe the public is hitting, particularly in the Phoenix area, a level of awareness of the crisis. We need to turn them into our advocates, to our eyes and ears. We got to give them a place so they feel like they're trying to save their neighborhoods, because right now, so many of them just feel helpless in what they see happening.
You know, it's interesting. You talk about, you know, where Cactus and 33rd Street or what, that whole area. My son goes to Chaparral, and there's a number of parents there who have all said, this is not going to happen. First of all, I don't even know what fentanyl is, and it's not going to happen in our backyard.
They don't know the history of Chaparral.
Wrong. Yeah, I know, right? Well, I went to Saguaro. You went to Saguaro. I
Yeah.
know. We had.
But my brother went to Chaparral and he was there during the Great Story.
Yeah. So we both know that because you and I went to Saguaro, he's at Chaparral now, that they don't believe that it can happen in their backyard. And the fact of the matter is this drug does not know financial boundaries at all. It can be any platform across the entire spectrum. So, Congressman, thank you. Any final thoughts you have before, we are able to move on? And I know you've got a floor vote that you have to move to, but are there any
but the staff is hovering over me because I gotta get to the floor in 4 minutes.
Okay.
This is a big deal. We're not being hyperbolic. It's changing our neighborhoods. Communities, neighborhoods I represent that used to just call me about economic issues now are calling about the fact that the little boy down the street just OD'd. The education, incredibly important. I have a 7-year-old. I already talked to her about, treat everything like it's dangerous. But we're going to have to do something I believe is much more proactive and is much more politically uncomfortable. And that is empower law enforcement and the community saying, no more of this. We're tired of seeing our kids being taken away in an ambulance. It has to stop.
Absolutely. Thank you, Congressman. We truly, truly appreciate your time. And I know you have given a lot of effort to fighting this issue. And so we appreciate you making time for us. So we look forward to hearing from you again in the future. Tell your staff thank you. Don't have them hover too much.
Right. And now
thank you again. So with that, I'm going to move over to Director Andy LeFevre. We're kind of back up because I want to talk a little bit about the Arizona Youth Survey and why it's important, why it's done in Arizona. And Director Andy LeFevre is with the Arizona Criminal Justice Commission, and I will let him do the overview of the Arizona Youth Survey.
Great. Thank you, Molly, for that introduction. And thank you for everybody who's tuning in today to learn or to learn more about this issue and some of the tools that we have available in Arizona to gather the information about what's going on with our youth, so that our communities and our substance abuse coalitions and our schools have better data to try and make better decisions off of. I am going to try and share my screen. So, second. See that okay, Molly?
We can, thank you.
Great. So I'm going to give you a little bit of an overview on the Arizona Youth Survey, and there goes my time light. Hold on a second. That's about the only exercise I get. We are responsible at the Arizona Criminal Justice Commission for carrying out on behalf of the state the implementation of the Arizona Youth Survey. And that is a statutorily mandated survey that we do. It's a biennial, so we do it every other year. And it's of 8th, 10th, and 12th grade students all across Arizona. This last implementation we went through, we had 51,000 plus students, 301 schools across all 15 counties participate in the survey. What this does for us is it's created, in essence for Arizona, probably our best tool for being able to assess the frequency of problematic behaviors in our youth and why are our youth participating in those kinds of behaviors. The survey is based on some nationally recognized methodology, so that what we do here in Arizona is very comparable to other states that implement similar types of surveys. It's up to the individual school or district. They decide whether they want to participate in the survey. And if they decide to participate, then there is parental notification that's sent home to the parents about the survey. And we have a passive parental consent form that's signed. So if a parent does not want their student to participate, they would sign the consent form and send it back in. That would opt the student out of the survey. The schools and districts that all participate, they get an individualized copy or report of what's going on in the school with those students that take the survey. So it's super powerful for that school or district to have that information. And then we also take that information, we produce a statewide report, county reports, and we have a tool which I'll show you here in a minute that we put on our website so that folks can kind of access that aggregated data to see what's going on in their communities. What does all that mean for the AYS? We've been doing this survey now in its current form since the early 2000s, which makes it the largest, longest running survey of youth in the nation. So it is a very powerful data set that we have available in Arizona to look at trends of what's going on with our youth over time. And it's been very powerful and very useful for folks like Shelly, who we'll hear from a little bit, that works in the Substance Abuse Coalition arena, to really be able to say what is going on with our youth, why are they participating in these kinds of dangerous activities, and what can we do programmatically to try and prevent that.
And Andy, while you're moving on to the next slide, you might want to speak up a little bit more.
Sure. I will try and do that. And that's usually not something I ever hear, that I have to speak up, but I'll do my best. So just a couple key points from the results of the current survey. Overall, we continue to see substance use in our youth going down. This has been a trend that's been going on for a while. I think a lot of that has to do with the great work that our local substance abuse coalitions are doing in our schools with our students in their community. We still see that the most commonly used substances in Arizona by our youth are alcohol, followed by marijuana. And by that, I mean leafy marijuana that they would smoke, then e-cigarettes, so vaping, and then marijuana concentrates is the fourth. And that is for 30-day use. If you looked at it over lifetime use, or so people that say they have used one of these substances in their lifetime, then actually marijuana concentrates jumps up to number 3, and e-cigarettes goes down to number 4. But again, we're seeing those numbers go down slightly, which is good news for everybody. We've asked some new questions on this current AYS implementation on fentanyl, because obviously that was something we were very interested in. And this was the kind of the troubling findings for us at the commission and for our substance abuse coalitions. When we asked students about fentanyl, have you heard of fentanyl? Have you tried fentanyl? We were really alarmed to understand that about 47% of our 8th grade students reported that they had never heard of fentanyl. Now, luckily, those numbers begin to drop as students get older, but as fentanyl becomes more available, and as the drug cartels are packaging it in colorful pills that look like candy, and it's becoming more accessible to younger students, that is an area of great concern for both the commission and for our substance abuse coalitions, which is we've got to get kids understanding earlier the dangers of fentanyl. And that also means that we have to have parents understand the dangers of fentanyl, because that is primarily who's going to talk to their kids about it. The other thing that was troubling is when we asked our students over the past 12 months, if you talk to a parent or a guardian about the dangers of fentanyl, less than 20% reported that they had. So there's a huge gap that we need to be in closing there on parents understanding the dangers of fentanyl and being willing to talk to their kids about it. But a couple key points. When we ask students about the most common reasons why they use drugs or alcohol, there's the kind of typical answers that are usually high there on the list, which is, I want to have fun, or I want to feel good. But what's troubling to us is this growing trend that we see in the next number of answers through 6 there, which is most of them deal with dealing with stress somehow or feeling sad. Our students are feeling stressed out about school, about parents and family, about their friends. They're feeling sad. That is something that I think, COVID certainly did not help. And I think we're going to see some long-term impacts from that period of time where students were feeling isolated there. But then when we ask our students, and I think here's the good news for those that are listening today, when we ask them the most common reasons why they don't use drugs and alcohol, there's I'm not interested, or harm me, or whatever. But the number 2 answer there is my parents would be disappointed in me. Or if you look down the list, then it would be somebody else, another caring adult, or somebody that I respect, would be disappointed in me, or that my parents would punish me and take away privileges. So this is important, I think, because I think this shows that kids do listen to parents. So it becomes critically important that we educate parents to be able to talk to their kids about the dangers of drugs, the dangers of fentanyl, because kids do listen to their parents, or if they don't listen to you, they at least fear what you'll do to them if they don't listen to you. So you as a parent that are listening have a lot of ability to kind of shape what happens with your child, and how they would perceive these kind of behaviors. And then I just want to point out, if I could, for the folks. So one of the things we do with this massive amount of data that we have available for the youth survey is we've created searchable dashboards on our webpage. So on our website, which is azcjc.gov, under our data tab, we have a number of data visualization tools that you can utilize to be able to go in and look at data from the Arizona Youth Survey. And you can search it several different ways. You can look at it by county. So the map of Arizona, you can click on any one of those counties and it will change the data to bring it to that specific county. Underneath that is you can do it by zip code. There's tools where you can circle several zip codes to pull it together. So if you're interested in what's going on in your neighborhood and it encompasses several zip codes, you could look at it that way. And then, or you could search by a certain type of substance or a certain grade, or all kinds of ways that you can get in and look at that data, because having that data available is really what helps drive what are we going to do about the problem. This is the dashboard that looks at the substance use. There's also dashboards that look at the risk and protective factors. So those are, what are the things that our kids are saying they're troubled by, or that are causing them to maybe participate in these kind of activities? What are the things that they think make them feel good and would prevent them from participating in these kinds of activities? And that's really where the rubber hits the road for our schools and our substance abuse coalitions, is they can use that data to say, boy, we're really seeing our kids mentioning X that they're troubled by. What can we do as a school to try and address that for them, so that they're maybe not feeling that stress, or that they would feel less likely to participate in those kinds of activities. And with that, Molly, I'll stop sharing my screen if I can figure out how to do that.
Well, Andy, go ahead.
Then just take look, I think we'll get questions towards the end of there, but my call to action for the folks listening is, talk to your kids. If you don't know enough about fentanyl that you feel comfortable, Shelly's going to give you a whole bunch of resources here in a minute to be able to do that a better job at talking to your kids. Somebody's got to talk to your kids. And if it's not you, it's going to be somebody you don't want talking to your kids about it. So I implore you, if you think your neighborhood is too nice, if you don't have a fentanyl problem, that's not accurate. It's going to be everywhere. It's going to be available to everyone. The kids will listen to you. So please go home and talk to your kids tonight about the dangers.
All right, thank you, Director. Yes, the Arizona Youth Survey has been a great foundation as far as helping schools and parents have resources to really educate students on risk factors. Shelly, I know you work really closely with a number of families who have lost family members to fentanyl. Can you introduce us to one of those families?
You bet. Yeah, I'll get that together for you. And actually, I'd just like to start off really quick, if I could, with just one quick stat before we get into the family story. And that is, if you take a look on the Arizona Pediatric Fatality Review, they do a review every year on the number on why children under the age of 18 are dying. And when you take a look at it, we're losing about one child under the age of 18 every single week in Arizona due to fentanyl poisoning. So 95% of overdose deaths in children 17 and under were caused by fentanyl poisoning. So I'd like to introduce you to one mom who lost her son, Isaiah.
Isaiah was 15. He was in the middle of his sophomore year in high school. He just had this light about him. He had this passion for football. He was a big brother. I get notification from a family member that there's a picture of Isaiah passed out circulating on Snapchat. And I said, well, what happened? They're saying that he took a pill. He went to go lay down and he just wouldn't get back up. These kids waited about an hour or so before they even called 911. I just couldn't believe that. Why wouldn't you call 911? I get there, he's in ICU. They're telling us that your son took Percocet, but we can't find Percocet in the system. We're pretty sure that your son ingested fentanyl, and they're telling me he's not gonna make it. He's brain dead, you know, there's nothing we can do. Your son is dying. We're not gonna be able to bring him back. I held him, kissed him, and I just told him, like, you know, I love you no matter what. You didn't deserve this. So I did tell him, you know, when I was holding his hand and I was sitting next to him, I said, you know, son, don't be scared. And it's okay if you want to let go. It's extremely important, you know, if you see somebody that needs help, you know, don't be scared to call, because, you know, there are laws that protect you from getting in trouble. Every second when someone's not breathing counts, every second, every moment. I don't know if Isaiah would have made it had they called 911 right away, but they did take that chance away from him when they decided to wait. I just hope that other parents, you know, maybe can talk to their children to prevent this from happening to their child. One mistake cost my son his life. Isaiah didn't want to die. You know, fentanyl changes everything.
And so with that, Molly, if I could
Isaiah.
just for those that maybe aren't familiar with fentanyl, I know that was the topic of discussion today, but what we find a lot is that there's a lot of confusion regarding fentanyl. And so if I could just briefly explain what fentanyl is for those that may not be as familiar with it, because there is legal fentanyl and there is illicit fentanyl. So fentanyl is an opioid. And so an opioid are used to reduce pain in the medical field and hospitals. And so there are some examples there on the left that you see of prescribed pain relievers, and fentanyl is one of those. And it is often used for day of surgeries and that type of thing. And it is a good medicine when prescribed by a doctor and used in a medical setting. What we're talking about here today is illegal fentanyl. So this is a synthetic or a man-made. It's made by drug trafficking organizations. It's precursor chemicals from China. They press this powder into pills and they sell it on the street. So fentanyl is about 50 to 100 times more powerful than heroin or morphine. And again, made specifically by drug trafficking organizations and brought into the United States. And as you know, or you may know, it only takes a little bit of fentanyl to have a huge impact or cause death in a child, especially if they're opioid naive. And that's what happened to Isaiah, is that he actually, one of his friends said, hey, only take half of that. And so he did take half. And that's another myth that kids have, is, well, just take half and then see how you feel and then take the other half. Well, then he did take the other half, and it was the other half that had enough fentanyl to kill 3 people in it that took Isaiah's life. So one of the things that fentanyl, when you take a look at it, the most common forms of it on the college stage, you'll see it in like Xanax bars, but mostly what we see here in Arizona are the blue M30. So that's what this middle one. We did see the rainbow fentanyl tablets, and that was kind of more of a marketing ploy. They charged a little bit more for those. But typically what we see are the blue M30s, and those are the ones requested the most. And I also want to point out that these pills are tiny. So it's only human nature for, especially a teenager, to think, geez, that pill is tiny, because it literally is about the size of an opening of a straw. So they're teeny tiny. You could fit 100 of them in a coin pocket in a pair of jeans. So they're very tiny, and they have an M on one side and then the 30 on the other. So a lot of youth, they'll swallow them, you can snort them, or you can smoke them, or they can be injected. And a lot of times this is how we see fentanyl pills being used now, is they're crushed and then they're smoked on a piece of tin foil, which creates a golden trail on the tin foil. It can have a popcorn smell, burnt popcorn, or a burnt plastic smell, because oftentimes straws or a plastic pin base is used to smoke the fentanyl pill. But this is really shocking. When you take, I've been working as a primary preventionist, which is I try to keep kids from using substances through their teenage years, because if we can do that, they're likely never to develop a substance use disorder as an adult. So in 2018, you can see fentanyl wasn't even on the radar, but just in 2021, 12 million pills were seized. And then just in last year in 2022, over 22 million fentanyl pills were seized in the state of Arizona. So that's a pretty huge increase that we saw there. And I want to go back to what Congressman Schweikert said, Andy touched on too, is that parents aren't talking with their kids. And so when we ask our youth, especially our teenagers, what's your number one source of getting information about substances? It's social media and the internet. So the internet is being used as an open drug market. I'm not trying to be hyperbolic here either, but there's a lot of drug activity available on Snapchat, Instagram, Facebook Messenger, Telegram, and TikTok. So it's something to be aware of. And Andy went into this. The one thing, Andy, I was just going to mention here is that the Arizona Criminal Justice Commission also asked kids, how easy is fentanyl to get? And about 1 out of 10 said fentanyl is easy to get. Now that's a number that keeps me up at night, because to think that 1 out of 10 of our kids think fentanyl is easy to get is scary. And Andy went into the whole talking piece about talking with your kids, but then also monitoring social media, know where they're going, keeping track of passwords and all of that. And then also it's really important to have a discussion about naloxone, which is a medication that reverses an overdose. So just like in Isaiah's case, the mother saw a picture on Snapchat of him circulating where he had been passed out. Those children were too afraid to call, but in addition, they didn't have naloxone, which could have reversed his overdose. So naloxone is a great medication. Always call 911 first. You can get it at any pharmacy, and you do not need a prescription to get it. And there are many organizations that now hand it out for free. And naloxone can be used on anyone, anytime, anywhere, and more than once if necessary. So we want people to be safe and don't hesitate, because even if a person isn't having an opioid overdose, it won't hurt them. It does nothing to them. So if they're having an opioid overdose, it restores breathing. If they're not, it doesn't do anything. And then this is the opioid assistance referral line that's answered 24/7 in English and Spanish. So if you have any constituents, anyone that you work with, any families that have questions about opioids, this is a terrific line that you can call to get answers 24/7, and it's answered by Banner Poison Control. In addition, there's a treatment locator where you can type in your zip code and get treatment facility locations closest to your home. This is when I typed in 85003, these are the providers that popped up. So you can see in this opioid treatment program, there are 195 seats available for them to be able to offer treatment to 195 people. So again, another great resource if someone is struggling with opioid use disorder or fentanyl use, or if they're using fentanyl. These are additional resources. We have information on fentanyl, naloxone information, how to spot an overdose, how to administer naloxone at talknowaz.com, or the Substance Abuse Coalition Leaders of Arizona, which is saclaz.org. Once you click on the toolkit, there are just so many resources that you can log on and get there at no charge. And you can even customize them and put your own organization's logo on there. So I think that's it, Molly. So I'll send it back to you with that.
Oh, thanks, Shelly. And you know what? Something that's really important, and I know, I believe Andy and Shelly maybe talked on this, the Good Samaritan law. So this year, I believe House Bill 2168 is moving forward, and that is a bill that will extend the Good Samaritan law to July 1st of 2028. And the Good Samaritan law is really, really important. So if you know of someone or any of your kids, you may want to educate them about this, that if they know someone who is currently has taken some one of the opioids, or I guess it's fentanyl, they can contact law enforcement or a healthcare provider, anyone, and have no repercussions. They just need to get that individual help. So that's a very important bill that's moving forward. I know that we got, go ahead, Shelly.
It's also to point out on the Good Samaritan law, even if the person that's calling has been using a substance themselves, they will not be arrested or prosecuted. And I think that's a holdback for some people, especially young people. They think, oh, I don't want to get in trouble because I was using too. They will not. So even if the person has been using themselves, they will not be arrested and they will not be prosecuted.
Fantastic. Director, did you have anything else on that before I move on to my last question? Okay, and normally Congressman Schweikert would be here, but I'm going to ask this of Annie and Shelly before we move on to opening it up for any questions. What can be done that you guys both feel can be done to continue to build on our efforts to fight this very serious drug issue in Arizona?
Shelly, you want to go first or you want me?
It doesn't, you can, Andy.
Yeah, you know, I think something the congressman said is interesting, and I think I agree with it in broader than just Congress. Like I don't think we've had our national "this is your brain on drugs" moment yet with fentanyl, so that folks really understand the dangers and the problem and the scope of it. And you know what we've seen as a society is when we begin to concentrate on something, we can usually maybe not wholly correct it, but we can begin to move the needle in the other direction. You know, we did that with smoking over a number of years. When meth was a big problem, we did it, and as long as we focused on it, we were able to kind of tamp it down. And you know, unfortunately, our focus shifts to something else, and it comes back. But you know, we haven't had that moment yet. So again, I think if you'd be surprised if you went to a soccer game on a Saturday afternoon and you walked down the bleachers and you did a survey of the parents sitting in the bleachers, how little of them would really understand what fentanyl is and what the danger is and the pervasiveness of it. So that we haven't quite gotten to that point. So, you know, to me, it's that's the area that I see we can do a better job of at the commission, and helping to provide better information to folks so that they understand what the problem is, and you know, continuing to partner with groups like SACLA and HIDA and those other groups that are out there, you know, taking that information and trying to turn it into something actionable, so that more folks understand what the problem is.
Shelly, did you have any final thoughts on some ways we can continue to fight this in Arizona?
I think it's a three-pronged process. You know, it is prevention on the one side. You know, whatever we can do. We've got so many kids that are stressed to the max. And that's the reason why they're saying they're using is to cope, or they're feeling sad or down. I think the pandemic created a perfect storm of a flood of pills and children feeling sad or down. There are a lot of kids that have been through traumatic events and are using substances to cope with that also. So whatever we can do to help alleviate some of the stress for our kids and to find healthy coping mechanisms and building resilience with our kids, whatever ways that we can do that. And then also from the enforcement standpoint, I mean, I truly believe that whatever we can do to try to get as many of the pills off the street as possible is good for especially our kids and teens, because the less access they have to a substance, the less likely they are to use. And then treatment, of course, we have to get over the stigma that this is not no one's fault. No one intended to take a pill or use a substance that was going to cause them to develop a substance use disorder. And that we really need to think of this as any other disease, that if your child has asthma or diabetes, we always take them to a doctor, we get them treatment. And even if they're on diabetes medication for the rest of their life, like some people use methadone the rest of their life, but they're living a productive life, they have their kids back, they're working again, that's okay. And so I know that sometimes methadone is a dirty word sometimes, but if it's helping the person lead a productive life, then we have to take a look at those types of things and offer medication assisted treatment as much and as often, or residential or inpatient, whatever the person needs. It seems like we've got an awful lot of money set aside for treatment. We just need to get people in and know that there's not a stigma attached. It's for the health and the safety of the person.
Thank you, Shelly. So I know a number of people have made some great comments. I'm reading them in the Q&A section, but I'm going to jump to some of the questions that we have. There's certainly, like I said, there's a lot of great comments, but one of the questions that was asked, are there any facilities accepting adolescents for fentanyl detox?
That's a great question. And it's one that we just had a young teenager overdose and die recently, and we were looking at some options before that young person died. So the answer is sometimes it's a case-by-case basis. I do know that there are some of the 24/7, the Centers for Excellence, I think they're called. I think I have been told, but I'm not confident in this, but I have been told now that they are doing medication assisted treatment for those down to the age of 16, which I know it's not young enough for some kids because it's very difficult for them to quit. They can't on their own, or so. But for detox, I'm not sure. That would be a question we'd have to take back and ask Access. And I think they do it on a case-by-case basis, depending on the treatment location.
And Shelly, along that same lines, we had someone ask when you were on the Access website for treatment centers, was that 195 beds available for care and detox?
Well, that was an opioid treatment provider. So, and so it's different. So you can search residential, you can search outpatient, you can search by all different criteria. So you just go in and you can search. There are different filters in there based on your zip code. So if you're looking for residential or you're looking for inpatient, it will tell you how many residential beds are available. So I just did kind of an all search, but you did notice that it also said on there like naloxone distributor. So if people are looking for naloxone, you can also see on there where you can get naloxone.
Okay, another question. Is there information on how successful recovery is for those with substance use disorder when fentanyl is the primary drug of choice?
And again, that's really a treatment question. I've only heard from community medical services, and I haven't seen them release any data. So I'm sorry, I don't have that. We need to bring a treatment expert on the panel to ask them and see what they're saying.
Okay, and we can certainly do that if we do this panel again. One of the people asked, can you please provide the 24/7 opioid phone number again?
Oh yeah, for sure. Right there.
All right, we'll keep that up for a few minutes while I'm still looking at some questions. There's a statement that someone said there was a massive shortage of adolescent treatment options for kiddos experiencing issues relating to substances and is separate within the Access directory.
It's true.
Yeah. Another individual says, education. As a father of 3 sons, my oldest lived to become a wet brain from ecstasy, and my 2 youngest deserve both from their fentanyl toxicities. I was never able to convince them not to use and abuse drugs. So I guess he says Phil, 34, is clean and sober. So I'm assuming that's the father.
Oh.
Let's see, another comment. COPE Community Services in Tucson, Arizona provides MAT services for youth 16 years plus. Will treat 15 plus if clinically appropriate.
Okay, awesome. I'm glad there's somebody on from COPE. Excellent, good job. Because that was actually the program I heard about. So I'm glad there's someone on from COPE.
Yeah, I'm just looking really quickly here. Let's see, I think that's all the questions that I've been able to get through so far.
You know, Molly, one of the issues,
ahead.
one of the issues we also have is, oftentimes when there's an overdose, they may not even be testing on whether or not it's fentanyl at this point. They just get opioid and they kind of leave it at that. So, part of the some of the communities, some of the counties have started doing overdose fatality review boards to try and dig a little deeper in so that we really do understand the problem of fentanyl. And it's not just an opioid problem. In Arizona, it's a very much a fentanyl problem. But I also don't want to lose sight of the fact that we still have a meth problem in Arizona. Many of the deaths are co-occurring with both meth and fentanyl in the person's system. So it's a dangerous mix of both of those drugs together.
Agreed. One of the other questions I'm having is how can we get schools to allow teachers to have Narcan in the first aid kit?
So that's something that we've been working with the Arizona School Board Association they drafted some policy to allow the school nurses to have naloxone in the school nurse's office. So I guess that would be a question as to whether, how big your school is, how close the school nurse is. I know some schools share a nurse, and so maybe that would be left to office personnel, but whoever administers medications for students, there is Arizona School Board Association policy and the National Association of School Nurses has set policy to allow schools to do just that. And we are seeing that happen more and more. In addition, the school resource officer always carries naloxone. They would have it. So if the school has a school resource officer, but again, understanding we had one school district here in Arizona that had a couple of fentanyl poisonings that were happening regularly on their campus. And they had the school resource officer at one end and a nurse on the other end. So, so it's good, you know, to have both. I honestly, I mean, given the work that I do, I mean, I have naloxone either in my purse or in my car.
And that's actually a really good thing to have. I was thinking about that as well for myself. Not for me, because I'm not, but I'm saying if I'm out and about and somebody does have an overdose, you have it there and available. You know, we're getting a lot of great discussion questions here. So forgive me. I know we've got a little bit of time here. What happens when education is not enough? Teenagers are naturally curious and can be defiant. DARE was seen as a massive failure and lost their funding. What is Arizona doing to focus on the best methods to deal with kiddos who already are using these substances, considering treatment is lacking and the streets are flooded with substances? I don't know if there's a Shelly or.
Well, it's a great intervention question. I mean, the thing is that I believe what we should be doing better is trying to intervene and screen early. Whether that happens at a pediatric office with a doctor and we're screening a child for depression. I mean, we screen kids for all kinds of things. Why aren't we screening them to see if they are using substances and then getting them a referral for treatment right away? Because, you know, typically what happens is a child's using, and quite frankly, sometimes the child is using for some time before anyone even notices that they're using. They've already even developed a dependence on nicotine. So, and parents are afraid to get their children nicotine replacement, but I mean, vaping is a real thing here too. We've got a lot of kids vaping nicotine and they can't concentrate in class because they need a nicotine, they need a hit from a nicotine vape. So, I think again, we have to take away that stigma that how can we identify kids in crisis or kids that are using early and to get them the help they need and the resources. So, and there was a school that I just was talking with the other day, had a young woman in there, 17 years old. She admitted she was using methamphetamine and fentanyl, and we got her into a program right away. And the school worked with her so that she could do remote learning because she was a senior and she wants to be a firefighter. So there was, we're not arresting her or anything like that. She got into a treatment center. She's doing well, and she's doing online school. So whatever we can do to wrap around our kids when they need that help, and we can get them the services and the treatment that they need, and get the schools to work with them so they can do remote learning, so that they can get their degree, so that they can go on to do other things, whether it's trade school, college, or be a firefighter, whatever that is. That's really important. But the earlier we can identify problems, the better.
And to just kind of wrap around the whole high school issue, I want to kind of come back to that. One of the questions says, wouldn't the teachers be covered under the Good Samaritan law if they had naloxone?
If they had it, yeah. And the thing is, it doesn't hurt to have it. Even if you're in a classroom of high school students and you have naloxone in your purse or in your desk drawer, I mean, if you administer naloxone and the person isn't having an overdose, it's okay. It won't do anything.
Okay. So another question, curious about your thoughts on whether fentanyl test strips and other strategies are more helpful or hurtful.
Well, I'm still waiting. I haven't seen any data on like Arizona's fentanyl test strip program. So that's what I'd like to see, how many people are using the test strips, I'd like to know what amount of the product in cocaine or methamphetamine are we seeing that is mixed with, that's mixed with fentanyl. And so, those are some of the things I'm curious to learn, because I think the bill just passed within the last year. So I'm really interested to learn from harm reduction organizations, like what are they seeing? Are people using fentanyl test strips? Whenever it comes up as a testing positive for fentanyl, is the person getting rid of those drugs, or are they using them in a safer manner with friends, with naloxone, or what's happening with that? So that's something I'd like to learn more about. The one thing I'm afraid of with fentanyl test strips is that it doesn't test for all of the fentanyl analogs. So because they only have to change like a molecule in fentanyl to get a whole different type of fentanyl. So that's the only thing I worry about with those. But I mean, I'd like to hear how it's going.
So I want to add, let's see. Oh my gosh, there's so many questions. I'm so sorry. And I'm trying to get to everybody. I know someone had asked, are we seeing this in other states as well? Are there other states that are experiencing the same sort of fentanyl crisis as we're seeing here in Arizona?
Yeah, the short answer is yes.
Okay. Did the Arizona Youth Survey determine whether youth e-cigarette usage has increased or decreased since 2022?
It's been going down as well. It peaked very much so in 2018, and then I think what happened was we had a lot of real high profile cases of kids going into the hospital and really getting hurt by e-cigarettes. And I think that created that shock value that helped to kind of drive home the message that they're dangerous. But I can't tell you, I mean, that's all I see out there is people smoking vape devices anymore. So, my fear with that perfect storm of a small technological device and a generation of kids that are enamored with technology is that we did away with 30 plus years of cigarette prevention and replaced it with a tiny little device that they think is really cool that they're going to use. But it is trending down again. But again, we'll have to wait and see what happens when we get back in one more implementation out of kind of the COVID timeframe to see what happens.
So
I think COVID may have tamped down some of these activities because kids just weren't out and about doing some of the things that they normally would have been doing during that time period.
So we'll take one more question. Who are the leading harm reduction organizations within Arizona before we wrap up here? Shelly or Andy, who wants to take that one?
You know what? I'm not a harm reduction expert. I know of two. I know Shot in the Dark and Sonoran Prevention Works for the state of Arizona. Those two are harm reduction groups. I'm sure there are others. Sometimes harm reduction groups, are, I don't know how the right way to say it, but they're not, they don't like a lot of publicity because they're working with people who use drugs. So, but the two that I know about are Shot in the Dark and Sonoran Prevention Works.
Okay, thank you. Well, I think that's it for us. And so I think we'll wrap up. I don't know if Jennifer comes back on or anyone comes back on to thank everyone. I'd like to thank all of our panelists, and if Congressman Schweikert was here, I would thank him as well. We know this is a very important issue and we really need to spread the word, children, friends, and others about the importance of fentanyl. Let's see. Jennifer said she put the hotline number in the chat for all participants. If you want to stop, I think that was a while ago.
Well, if we could just for anybody who's interested to get more information about the youth survey, it is on our website, which is ACJC.gov, and there's an AYS page. It is most of the schools that participated for a pretty long time because they see and understand the value of having this data available. So if you would like to see if your child's school is interested, then please get some information or contact us and we'd be happy to reach out to them and see if we can get them signed up to participate in the next implementation, which would be the 2024 Arizona Youth Survey.
And thank you for that, Andy. Shelly, any other final words from you?
No, but if you are working, if you're from a municipality or anywhere in the state of Arizona, you can put in a request through Andy's organization by zip code and find out exactly which substances youth are using in your zip codes. And that can be really important because that's whenever I'm working with a group or a coalition, I'm right here out of my house. I can search my zip code or the zip codes around me and find out which substances kids are using most so that we can have targeted work so that we're not focusing on something that maybe isn't an issue. Because I think someone had mentioned maybe in a Q&A or something that we have to look at regional issues too, right? So while, vaping nicotine might be an issue right here, methamphetamine might be an issue in another zip code in another part of the state. So, that's really important. It's a great part of the Arizona Youth Survey is you can drill down that data right to where you live and actually come up with strategies and solutions that work for your community.
Thank you.
And if I could just add, Molly, they can go on the website and they can drill down themselves in the data visualization tool and go right to the zip code level and look for that themselves. But if you have issues, please contact us and we're happy to help.
Absolutely. And I'm being asked to give the opioid helpline 24/7 number again. It's 1-888-688-4222. So with that, I thank everyone. I thank our panelists and of course the Flinn-Brown Civic Leadership Academy for hosting us today.
Thank you.
Thank you.
Thank you.
Bye.